Yes. So as you know, we're helping business owners by promoting, what they're doing in the community, what's working for them well, so that we can, promote that on our social media and let the community know what you're doing.
Clara's Healthcare is a private home care business. We provide services to age groups from newborns to our geriatric patients. We do services such as skilled nursing services, um, personal care services, and companion and sitter services. The skilled nursing services is referred to us by a doctor or a family member, and that's where we have a nurse or a CNA to go out and care for the patients during various hours of the day. And then the personal care services is more like gearing towards ADLs like bathing, helping to transfer the patient, and things of that nature. About taking care of patients and people, especially our pediatric population and our geriatric populations. Those are our two most vulnerable populations that we have. Um, and that's to include our medically fragile, but I'm also a registered nurse, and I've been a nurse for 10 years. And so I've always had that passion. I'm looking at more of the age group of between 30 and 45 because those are the ones that have the parents that need assistance, or those are the ones that have the babies or the foster care. There are a lot of foster care parents at that age too, as well, that has medically fragile or medically complex um, kids. So I'm trying to target those age groups definitely. I really haven't seen an impact when it comes to the COVID-19. If anything, it's more so of there's a higher need because of the impact of COVID-19 on patients. Uh, they're needing more assistance at home once they recover in the hospital. So they have to continue their recovery at home. So it's more people coming out needing assistance more than anything. One of the things that we do is that we always follow CDC guidelines. We always follow the literature and the recommendations of CDC and the local health department as well. We always make sure that every staff member is fully aware and updated with the most recent recommendations, and that we are going in with gloves, hand sanitizers, um, even soap. Soap definitely helps out. And then we're educating the clients and the client's family as well when it comes to this pandemic. Even though it's easing up, we still want to continue to practice uh, what is recommended on a daily basis and educate our clients. So we're definitely on top of that.
That's wonderful.
Thank you. My grandmother.
Right now. Your grandmother?
Yes, my grandmother. That was my rock, my foundation. And that is who I named my company after. Her name is Clara. And she was a nurse as well, and she loved people. She loved people. She cared for them regardless of what condition they were in, whether it was good or bad, the sickest of the sick, the healthiest of the healthy. She still cared for them. There was not, um, let's just say she always had a naked eye, if that made sense, and a warm heart. So that she is my motivation. She is one that keeps me pushing and pushing and pushing. Even when I feel like, oh my gosh, this is not moving how I want it to move, I always think back and hear her voice and say, patience. Patient rushing gets you nowhere. Just patience. Just hang in there. It's going to be okay.
Yeah.
But she's my motivation through these times.
That's pretty amazing.